In this session, we're going to go through some exercises that can be really good for helping you out if you're suffering with back pain, which is of a discogenic element or sciatica. So if you have this type of back pain, it often responds much better to doing lots of extension-based exercises. So that's what we're going to focus on in this session. So give it a go and see how you get on. I hope it helps. So we're going to take a stand with our feet about hip width apart. And then we're just going to go for a few shoulder rolls, just make sure we're nice and relaxed through our shoulders. And then we're just going to relax those shoulders back and down, taking our hands onto our hips, and we're going to try some pelvic tilting. So tipping forwards and backwards, just letting your lower back arch and flatten as you tilt. And then we're going to find our neutral spine position, that halfway point between our back being as flat as we can make it and as arched as we can make it, that middle position for you. Once you're into that neutral position, take a nice big deep breath in. As you breathe out, think about drawing up and in through your pelvic floor muscles, drawing your belly button in towards your spine, get that core engaging and switching on. Keeping that core nice and active. You're going to relax your hands by your sides, check those shoulders are dropped away from your ears. So core is switched on, pelvis is stacked over our feet. We're going to take a nice side bend down to one side and then coming back up, and then switching sides, side bending the other way and then coming back up. So breathe out as you flex, breathe in as you come back up again. So our core is active as we're moving. Pelvis is staying stacked over our hips, so try not to let your hips shift over to the side here. Try and keep that equal pressure between your left and your right foot. And you might find if you are experiencing back pain at the moment, you might find that you can't go as far one way. So don't worry if you're not going as far, just working through the range that feels good for you today. And don't worry if you're going further one way than the other. Just trying to get that nice gentle movement. Time with your breathing can really help here. So breathe out as you side bend, breathe in as you come back up, watching that chest stays open. Try not to lean forwards as we bend into our movement. We'll go for one more of these in each direction. Lovely, and then coming up from there, we're going to take our hands onto our hips and we're going to move out of our neutral spine position for this one because we're going to try some extension. So I'm just going to show you from the side so you can see. So feet are going to stay hip width, hands on our hips, keep those shoulders back and down. And we're going to breathe out as we flex back, and then we're going to breathe in as we come back into a neutral position, standing nice and tall. So breathe out as you flex back. Breathe in as you come forward, just working through the range that feels comfortable for you again, okay? Sometimes when you do back bends, it might increase the pain locally into your back, but if you have any leg pain, hopefully it's going to help to reduce that. So it shouldn't increase the pain into our legs. If it does, then don't go back as far, or you might want to stop doing this one. But hopefully bending backwards, if you've got back pain that's related to our disc or sciatica, flexing backwards is often really helpful for this one. So breathe out as you go back. And breathe in as you come forward. Think about using that core to help bring you back up again. So we're just going to go for 3 more here. I'll just show you front on as well. So back and coming back up. And let's just go for 1 more. And then back up from there. Lovely. Okay, from here we're going to come down onto the floor. So often you can find that flexing is not so nice on your back if you're experiencing sciatica here. So you might just find that you want to just do a little round through your shoulders and then crouching down, and then we're going to take ourselves down in this position and we're going to have a lie down and we're going to prop onto our elbows here. So we're going to take our elbows under our shoulders. Just think about having those hips down into the floor. So just into a gentle arch through your back. So again, we're away from that neutral position. We're arching through our back. Just going to think about working through our shoulders here. So it's going to help just changing our back position a little bit as we work into our shoulders. So you're going to slump down into your shoulders here. And then as you breathe out, you're going to push away your elbows, squeeze your shoulders back and down, and just look straight in front of you. And then as you breathe in, you're just relaxing down. So breathing out, pushing back and away. Breathing in as you relax down. Breathe out as you push back and away. And breathing in as you come back down. We're going to go for 3 more here. That's it, really squeezing those shoulder blades back and down. Keep those hips down into the floor. And we'll just go for 1 more. Lovely. When you do that last one, you're going to come all the way down, take your hands under your shoulders, and we're going to try our cobra. So working into a bit more extension here. So elbows stay nice and close into our body, and we're going to breathe out as you push up. Breathe in and hold at the top, and then breathing out as you come back down nice and smooth. Think about a nice smooth segmental movement as we roll up and control ourselves back down again. If you find this movement is a bit too much for you, you can make the range smaller by taking your hands a bit further in front of you, and then you'll find that you're just not going to push up quite as high, and you'll probably find that's a little bit more comfortable, a bit more manageable on your back. So breathe out as you push up, breathe in and hold at the top, and then breathing out as you come back down. Breathing in at the bottom, breathe out as you push up, breathe in and hold at the top, and breathing out as you come down. Try and keep those elbows nice and close into your sides as you're pushing up and down. Take your time with it. Let's go for one more, timing it with our breathing. Lovely. When you've done that last one from here, we're going to push ourselves up onto our hands and knees, and then we're going to take a turn onto our backs. So having a turn over. You've got a little pillow, you might want to just use that here as you come onto your back. And then on your back, just having your arms by your side, just a little bit wider than your body. And then you're going to bring your feet and your knees together. Just take your knees nice and gently side to side. Just giving your back a bit of a stretch into rotation as you rock with your knees. And again, you might find that you can go further one way than the other. That's fine. Just work through the range that is comfortable for you. So going for that nice gentle movement into rotation. Breathe out as we lower our knees down. Breathe in as you bring them back into the middle. And then take your knees back to the center. Bring your feet to about hip width, little space between our knees. Fingertips on our hip bones. We're just going to try some pelvic tilting here. So you're going to tilt back, flatten your back to the floor. And then you're arching away from the floor. So get that nice gentle arch of your back. So your pelvis is staying down to the floor, tailbone is staying to the floor. So we're just tipping forwards and backwards through our pelvis. So you're going to breathe out as you tilt back. Breathe in as you tilt forwards and let that arch just appear in your lower back. Breathe out as you squash down. Breathe in as you arch back the other way. Just feeling our pelvis move with our fingertips. So just mobilizing through that lower part of our back as we arch and flatten. We'll go for two more here. Then we're going to find our neutral position. This is our halfway point between our back being as flat as we can make it and as arched as we can make it, that middle point for you. Once you're into that middle or neutral position, fingertips on your hip bones, just bring your fingertips in 1 centimetre or 2 from there. So just feeling that soft part just in from your hips. And then we're just going to think about engaging our core muscles. It can be a bit tough to engage our core muscles when we're experiencing back pains. It's good just to do some focus work on getting them to engage. So you're going to take a nice big deep breath in. As you breathe out, think about drawing up and in through your pelvic floor muscles, drawing your belly button in towards your spine. You should feel a gentle tightening up underneath your fingertips. And then as you breathe in, we're going to release and relax through those muscles. And then as you breathe out, think about drawing that belly button in towards your spine, engage that core. Again, hopefully you can feel that tension. Breathe in. As you release and relax, we'll go for two more. Nice strong out breath. Engaging that core as you exhale, keeping that back neutral. Breathing in to release. And last one here, breathing out as we engage. And then breathing in as you release. Well done. Then one more exercise here. We're going to just stretch into the backs of our legs so it can help to stretch and mobilize our sciatic nerve. You're going to lift one leg up, take your hands behind your knee, just holding your knee in a comfortable, and your leg in a comfortable position here. Then from here, you'll relax through your core. You don't have to have your core engaged. Your back can be in whatever position is comfortable for it at the moment. And then from here, you're just going to straighten your leg out and then you're going to flex it back in towards you. And don't worry about the range here. So it doesn't matter if you only just do a really small movement up and down. Okay, or you might find you can go a little bit further, or you might find you can get your knee all the way straight. Just work through the range that feels comfortable for you. So breathing out as you straighten, breathe in as you flex. So breathe out as you straighten, breathe in as you flex. So this can just help to just gently stretch and mobilize into the back of our body, the back of our leg, our sciatic nerve. We're going to go for about 10 of these on each side as we go up and down nice and smoothly. And last one. Well done. When you've done that last one, lowering that leg down and then switching sides, lift your other leg up, holding behind your knee again. And again, nice and smooth it up and down, time it with your breathing. Again, just work through the range that feels comfortable for you. Breathe out as you stretch up, breathe in as you flex. So don't worry, even if it's just a really small movement like this, that's absolutely fine. We want to keep everything manageable. I don't want you to feel like you're increasing your leg pain if you have it as you flex and straighten here. Keep it nice and smooth. That's it. Work through that range that feels good for you. And last two here. And then lowering that leg down. Well done. You might just want to give your knees another little gentle rock from side to side. Just think about just relaxing through your back, relaxing through your core, feeling nice and relaxed through our body. And then bring your knees gently over to one side, whichever side feels more comfortable for you. Taking a slow turn onto your side. And you're going to take a slow sit up from there. So taking a sit up when you feel ready to. Coming and having a sit round when you're ready there. And fingers crossed, your back is feeling a bit better for doing those exercises. I really hope it helped. If you found that helpful and you'd like to continue with working on getting yourself feeling better, feel free to subscribe to this YouTube channel. You can also follow me on Instagram, which is @animatedphysio, or you can find me on my website, www.animatedphysio.co.uk.